You have Mayo experience, so you know I spent a couple of years in general surgery before I came to my senses, but for much of that 2 years, I spent learning about gastric surgery for peptic ulcer disease, and it was presented with certainty and a sense of disbelief if there was any questioning of that, and because the stomach, of course, was such a hostile environment that bacteria could not possibly live in the stomach. And so there were lectures on gastric resection and Roux-en-Y's and dumping syndrome and every other complication you could think of, until a 15-cent antibiotic was discovered that pretty well takes care of most peptic ulcer disease. So I think there's a risk in adoption of therapies, or a risk in sticking with therapies when there's tremendous dogma and conflict of interest, and that situation